So today we're with Dr. Chow here. She's a gynecologist at Neuro Medical Center, and today we'll talk about female stuff. Okay, Dr. Chow. Most types of clients who ask about their female menstrual cycles and stuff, sometimes it's not regular or sometimes different, have spotting or these kind of things. So sometimes they say they have so what's the main cause of having irregular periods, or maybe is it a hormone imbalance, or is it they have some sort of some people have chocolate cysts and those kind of things.
Okay, so most of the time if they come with them bleeding between cycles or very prolonged bleeding that doesn't stop, most of the time we will do the ultrasound, mainly to focus on this area. This is the area where our menstruation comes. Okay, sometimes we find some shadows inside the uterus. We call it polyps.
Okay.
With these polyps, the menstruation can be significantly affected.
Okay.
Yeah.
So is this a hormone imbalance or?
Hormone imbalance is another thing.
Okay.
Hormone imbalance is usually happen in the girls, young girls, or the women that near the menopausal age.
Okay.
Usually with ultrasound we cannot see anything.
Okay.
Yes.
So mostly it's just if they have a polyp or no polyp. So I see that some people have is it because of the menstrual cycle they have sometimes have a polyp, or is it a condition they have, or what any reason that they have this?
For the polyps, most of the time there's no reason.
No reason. Okay.
Yes, but we need to take it out to check the cells if it is a normal or abnormal. Sometimes we can find some very the cells could be changing, or sometimes it can be even cancers on the polyps. So it's essential to take it out. Okay,
so it's essential for mostly females to have a checkup regularly, or what do you recommend like this?
For the polyps, usually the woman will have symptoms.
Okay.
Most of the time they come for like irregular cycles, prolonged bleeding, or bleeding between cycles. Sometimes they will have very severe pain during cycles, or very heavy flow. Then we'll find it. But only a few of them will come with no symptoms.
Okay. So I heard also about some chocolate cysts. Some people are asking, some people see a doctor and they say no need to do any operation or take it out, leave it there, just normal checkup is okay. Is that true? Is it better to take it out or better to leave it there?
Chocolate cyst is another issue. Chocolate cyst is the problem in the ovary.
Oh, okay.
Yes, yeah, either left or right.
Okay.
It is a collection of the old blood, or we call it menstrual blood.
Okay.
And yes, it's true that some of them doesn't need to have operation.
Okay.
Usually we look at the size.
Okay.
If it is on ultrasound, it's like a chocolate cyst and the size is less than 5 cm, we can try to use the hormone therapy.
Oh, okay.
Yeah. After hormone therapies, most of the women will have like shrink in size.
Oh, okay.
Or some of them will remain same size, and she may not need to operation.
Okay. Is it dangerous or not dangerous?
The chocolate cyst itself is not dangerous.
Okay.
But sometimes if it's big, it could have some complications.
Oh, all right.
Imagine this is a balloon. As it becomes bigger, it will burst with bleeding.
Okay.
And sometimes if you have the woman have pain, then she needs an operation.
Okay. Yeah.
你諗下點接落去下一條片係啦。
Okay. We've talked about the cysts, right, and the polyps already, and we'll ask Dr. Chow about other female
順暢啲講多次係啦。
gynecological problems. Okay, we've just talked about cysts and polyps in the female reproductive system, and with Dr. Chow, and later on we'll talk about other female gynecological problems. Okay, thank you.